welcome to my channel, and you know this is all about community medicine. And this time I'm back after a bit longish hiatus and with a different type of topic and for a different target population. So what is it about? It is about a very quick recap guide to the basic course in biomedical research. Well, this is one of the courses made mandatory by the NMC that every faculty, be it from the pre-clinics or the paraclinics or the clinical disciplines, has to undergo this course in biomedical research, which is usually commonly called the BCBR, and that is affiliated under the ICMR NIE. It is a wonderful course which takes you through a graded journey of the research methodology, because NMC believes that the research culture needs to be inculcated in every individual, in every clinician, in every health professional. And with that agenda, this course has been inducted into the whole process. But the thing is, for the people not belonging to community medicine, it is little difficult to cope with their own clinical or other subject agendas and gather the technicalities in time to appear for the final examination which one has to clear. So this is not exhaustive, I'm telling you again, but it is a definite help which you will get while appearing for your final examination of clearing the BCBR. Because there is a certain must-know areas, there are certain very basic questions which you need to know. So what are we waiting for? So the basic concepts of research study: formulating research question, hypothesis, objectives, literature review, the epidemiological consideration in designing a research study, the biostatistical considerations in designing a research study, the ethical issues, and how to write a research protocols. These are the basic sections under which the entire curriculum of this course is consisting of. To the conceptualizing a research study, we need to have an introductory thought about health research, formulating research question, hypothesis, objectives, and some basic understanding about literature review. Now, coming to health research, there are different dimensions of health research. So, in one side there is theoretical research and applied research, where theoretical research is conducted for theoretical purposes, and when you have some good evidence created out, that we go for applied research. Next is the preventive and therapeutic research. When the preventive technologies, as they emerge, they have to be tested out through research methodologies, as well as newer therapeutic options become available, they need to be tested out through research methods. The next dimension is between the bench-based research and bedside research. The bench-based research is which is carried out in the laboratories on animal models, and bedside research is which is carried out on the human subjects. This is one place where you have a definite MCQ, a very common one asked in this BCBR, that is, what is the type of research that is carried out in animal models in laboratory setting. Of course, now you know it is the bench-based research. Besides this, there is exploratory research and confirmatory research. In exploratory research, we do not know how much about it is right in the beginning, but we try to find out. And in confirmatory, we have a thought process in mind, and we want to confirm it. And finally, another MCQ favorite, that is the implementation research and the translational research. The implementation research is a scientific inquiry that seeks to understand the acceptability and functionality of a health program. That all those health programs that are running, how far and how well are they running? That is the implementation research. So you will find questions given a scenario and you have to deduce what type of research is that. So if this fits this scenario, like maybe a vaccine trial or something like that, no, in that case it is an implementation research. Whereas the translational research is when research findings are moved from the researcher's bench to the patient bedside and the community as a whole. For example, the drug development, vaccine development, moving on to actual implementational scenario. That is the translational research. Again, keep this in mind. These are very common areas of questions for BCBR, and often this translational research is given in the different types of study design and asked which is not a epidemiological study design. Please get it clear that translational research is not a study design. It's a dimension of taking up research. Now coming to the research question, but before that we need to have a fair understanding of the life cycle of the research. Why so? Because there are plenty of questions which comes from this area where a particular step is mentioned and the next step is asked for in the MCQs, and among the choices you need to point out the right one, or you may be asked to arrange according to the proper sequence. So the right one is the identifying the data needs, spelling out the research question, formulating the study objectives, planning the analysis, preparing the data collection instruments, collect the data, analyze the collected data, draw conclusion based on the analysis, and formulate recommendation based on the conclusion, and eventually inform the stakeholders, and identify the data needs again based on the information. So it is often given then what is the immediate step before informing the stakeholder. It is the recommendation formulation. Now coming to certain other principles of health research, we have to keep in mind, that is the planning, teamwork development, and roles and responsibility assignment to the team members, as well as review. So these are the basic three principles of health research. Now there may be questions like this. There are several choices in which you will find that there is a choice other than these three in the principles of health research. You have to rule that out. Coming to review, which is again a favorite from the MCQ point of view. There are basically three reviews which are carried out before a study. There is scientific review, regulatory review, and of course the mandatory one, that is the ethical review. The MCQ also has a typical asking that which is the mandatory review before a health research is commenced. Now you know it is the ethical review, which is looking into the human and animal protection rights as per the national guidelines. It also looks into the informed consent and assent, whether the trial is registered with the clinical trial registry, data confidentially is mentioned or not. These are also a different set of MCQ which may have this. Coming to the scientific review, it looks into the novelty of the study, rationality of the study, relevance of it. The soundness of the study design is also looked into by the scientific review committee. So the sample size, the randomization procedures, if properly used or not, those are looked into by the scientific review committee. The regulatory review, on the other hand, it evaluates the preclinical trials data, assess the in-country regulatory requirements for any import, ensure the national requirements for special situations are met, sample shipments and transfers, the IPR issues, exchange of scientists, budgeting. These are looked into by regulatory review. And another question it comes in this review perspective is, often in ethical review, a choice is given, it is 3-4, and which is not a part of ethical review. The commonly odd one out given is the intellectual property that is not looked into by the ethical review. Now another important area, there is the research question, which also finds a lot of questions in the BCBR exam. There's what are the sources of research question, what are the steps, and sometimes it is given, the choices are given of the steps, and it is said, which of these are steps of framing a research question. So if all of these are present, you just need to tick the all of the above. And sometimes you may be asked to organize the sequence of these steps. So maybe literature review is marked 1, research question is marked 2. So 1, 2, 3, 4, 1, 3, 4, 1. Such sequences may be given, and you have to choose the right sequence. The right sequence is a review of literature, raising a question based on that, peer review, define measurable exposure and outcome, sharpen the initial question, and refine the final question. So for that, you need to know this part. Now, another common research question based MCQ is the verb one. That if estimate is used, what type of research question is that? If the verb determine is used, what type of research question is that? If it is estimate, it is a descriptive research question. If it is determine, it is analytical research question. And now there is the FINDER. It is an acronym for, developing a research question. That a research question needs to be feasible, interesting, novel, and here the basic problem lies with the R, because that is where they make the changes, because R is here for relevant, but they might give you for reliable as the choice, which you need to rule out. The hypothesis. It is an assumption or perhaps a tentative explanation for a specific process or phenomena that has been observed during a research. Now, this particular area has lot of takers for this MCQ purpose. For this, you need to have a concept about what is null hypothesis, what is alternative hypothesis, what is the power, when do you reject it, when do you accept it, when it is right and when it is wrong, and what are the basic criteria of any hypothesis. Okay, so let's begin. For the null hypothesis, it is usually denoted by H0. A null hypothesis is a statement that defines the opposite of the expected result or outcomes throughout your research. So basically it states there is no difference. Whereas alternative hypothesis, which is often denoted by H1, it is usually directional and has an expectation which it wants to gather. But sometimes it may be no directional as well, but we'll not get into that. For you, it is important to note null hypothesis means there is no difference. Alternative hypothesis contradicts the null hypothesis and it holds a particular view. And if null hypothesis is rejected, we accept the alternative hypothesis. So now let us have a clarity in mind from the MCQ point of view that a hypothesis of a research cannot be revised based on the study findings. It is done prior to the study. It is always a priori. That is exactly how it will be written in your MCQ. And a good hypothesis always looks at one exposure and one outcome. So these are the three basic things you need to remember about the attributes of a good hypothesis. Now let us understand one of the basic concepts based on this null hypothesis and the decision we take. And as a result, the errors we make. Again, I am telling you, must keep in mind that no research is error-free. But supposing we have a certain null hypothesis. It is true and we accept it. Then the decision is correct decision. And the probability that we accept it is 1 minus alpha. It is called the confidence interval. But supposing the null hypothesis is true and the researcher rejects it, it is called the type 1 error or the alpha error. It is minimized by decreasing the alpha. It is called significance level. Now, if the null hypothesis is false, but we accept it, we are committing a type 2 error, which is called the beta error. It is controlled by the sample size, the type of the test, and the effect size. Supposing it is false and we correctly reject the null hypothesis, then that is the power of the test. That is doing things rightly. That is called 1 minus beta and is called the power of the test. It is increased by increasing the sample size, choosing the test with greater power, and by increasing the alpha. So this basic grid is very important from your MCQ point of view, because you might find a lot of questions which will be around this type 1 and type 2 error and the power of the test, which is the 1 minus beta. And 1 minus alpha is the confidence interval. And alpha is the type 1 error and beta is the type 2 error. The literature review. But why is it carried out? So that the researcher knows it better. They get to explore new topics, identify the lacuna in the existing knowledge. So making it more concrete in the sense. So these are again MCQ areas where several choices are given that why literature review is carried out for. Just remember one thing, literature review is not meant for guiding the eventual finding. It is basically for detecting the lacunae, knowing the area better and developing more newer insights into the topic, but not guiding the study finding. So the research has to be followed through certain steps of literature review, which again has questions from it. That is the basic 4 steps. That is, organize the information, synthesize the result, identify the lacunae, and develop the research questions. These are often given as MCQ. All these 4 and maybe given and maybe said, which are the steps of developing or going through a literature review. And if all of the above is given, you have to select the all of the above. or there may be some odd one out other than these four, then you have to rule that out. And some of the common databases which you should be conversant with, again from the MCQ point of view, like Medline, MBES, Google Scholar, and things like that. And again in this, the incidence studies, those are most useful for evaluating impact of prevention programs. And the prevalence ones, those are looked into when there is high cure rate and high case fatality, or low cure rate and low case fatality. These are the areas of prevalence studies. In this context, it is also good to know that literature review is one of the best methods of eliminating effect modifiers, which we will discuss shortly when we will take up confounders and the effect modifiers. The literature review is the best way to handle that. In this context, it is also good to know the critical appraisal, which is the ability to apply the principles of analysis to identify those studies which are unbiased and valid. Critical appraisal also is often given as MCQ. You have to identify this particular language and see if it's there, put it down as critical appraisal. Another important aspect from literature review is the Boolean search strategy. That is whether to use and, or, not, except. So when you want to record all the words and you want records that contain all the words, the Boolean search is used is and. When you want the highest number of results for that keyword, connecting the synonym of one keyword, that is or. So not is for the leaving out the other alternative. So commonly the MCQ is focus on the and or Boolean strategy. They will give you a situation and ask you that which Boolean search is best for this. So while and refines your search, or broadens it. Use or to capture concept that might be represented with two or more different words. It can be a safeguard against missing results because you have used the wrong term, or because researchers have used different terms or different spellings in different parts of the world, and over time to capture the concepts. So now from that we move on to the epidemiological studies. Again, here we will find plenty of MCQs where you will be asked, given a scenario, that what is the study type, and you have to assess. You first and foremost check out if there has been any exposure, any intervention present. If yes, it is an experimental study. If not, it is an observational study. If the experimental study has been allocated the sampling randomly, that is, every subject had an equal opportunity of being selected, then it is a randomized controlled trial. Else, it is a non-randomized controlled trial. Now, in the observational study, if there is a comparison group, it is an analytical study. If no comparison group, it is a descriptive study. The descriptive study intends in formulating the hypothesis. An analytical study, it is for testing the hypothesis, that whether it is tenable or not. In analytical study, when you are looking at the individual as a unit, you have different types: case control, cohort, cross-sectional analytical, and if it is in the population as a unit or a group, it is called ecological studies. So in the experimental studies, if the healthy people are taken as unit, they are called field trials. And when the community is taken as a unit, it is called a community trial. The common MCQ from this area usually involves that, such and such, or maybe a COVID vaccine has been introduced, how far it has been able to reduce the mortality or morbidity in the community. Then what kind of epidemiological study you need to undertake. So in this case, it is usually the experimental field trials. So once you get this grid done, you can safely answer at least 2 to 3 questions which will be around this area. Besides this, you also need to have a clarity regarding the cross-sectional and longitudinal study design. Cross-sectional, you are studying different groups at the same time, at one point of time. In longitudinal, you are studying the same group, but over a period of time. So that clarity has to be to validity. Well, as for the research objective, validity is must in terms of external validity as well as in terms of internal validity. The external validity is about obtaining an estimate that is generalizable to the relevant target population. You have to keep in mind the basic concept that the entire population the researcher can never cover. So, depending on the research question, there is a target population which the researcher is looking at. And from that target population, a sample is taken. So it is important the findings of that sample is generalizable on the target population. It is equally applicable. At the same time, internal validity is equally important, which is about obtaining an accurate estimate of disease frequency and effect of exposure on health outcomes in the study population. Another term which is pertinent in this context is accuracy. It is about findings being precise as well as being valid. If precision is about every time the study giving the same result, then valid in this case is about measuring what it is supposed to measure. All these areas have MCQs coming from these. Another common MCQ is about the threats to the validity. What are the threats to validity? The threats to validity are selection bias, information bias, and confounding bias. In this context, it is good to mention that any research study is always prone to errors, as mentioned earlier also. And this error, apart from the type 1 and type 2 beta error, it can also be classified into the random error and the systematic error. The random error, which is, happens as a form of a natural variation, and it is called chance. The MCQs usually comes, what is the random errors commonly known as? You have to mark it as chance. And the other one is the systematic error, which is called the bias. There are several forms of bias which you can go through if you want to. I will provide you in the link in the description box if you want to know the details of it. The method section. Here, what you need to remember that it has certain basic points. In the methodology, we have the study design, description of the interventions, particularly in experimental studies, study population, operational definitions, sampling procedures, sample size, data collection, analysis plan, project implementation plan for quality assurance, and the human subject protection. These are the points that are included in the method sections. So, If in the choices any of these are present, you have to say yes to that. In this context, another important thing while deciding the study population is the inclusion and exclusion criteria. The inclusion criteria are the characteristics that the prospective subjects must have if they had to be included in the study. Whereas exclusion criteria are those characteristics that disqualifies the prospective subjects from inclusion in the study. And these may include factors such as age, gender, race, ethnicity, type, stage of disease, and many more. Now coming to the confounders and effect modifiers. These are very important and we often have MCQs from these areas which involves that there is given a statement, then it is only affecting the outcome. What is it? Is it a confounder? Is it effect modifier? And there may be some other options as well. It is affecting both exposure and outcome. Then again you have to make the right choice. And then the other MCQ that comes from these areas is that at what stage which mechanism is adopted to restrict these. So you have to remember in this context that confounding is something that is affecting both the exposure and the outcome, and you can control it at the design stage as well as at the analysis stage. At the design stage, it is restricted by restriction, matching, and randomization. Whereas in analysis stage, it is through stratification and multivariate analysis. If the statement says that the particular third variable is affecting only the outcome, then it is talking of effect modifier. For every confounding present in the study, one needs to increase 10% of the sample size calculated. So this 10% sample size increase is also another common MCQ, apart from the ones mentioned. Confounding, you have to remember one very important thing, that it may simulate an association that does not exist, and it might hide an association that exists. It may change the direction of the effect, and it may increase or decrease the strength of the association. So basically create a confusion. You have to remember that confounding is the biggest threat to validity. Now coming to population and sample, and how and what are the things you have to keep in mind while getting to the sample. As I said, the universe, if it is the population, then from that we get the target population based on your research question. And from that you get the accessible population, a subset of which is the actual study sample. Now the MCQ that is common in this area is that what are the factors that you keep into account while moving from population to target population. These are the clinical findings and the demographic findings. While from target to accessible population is the geographical ones and the temporal ones. So CD between population and target population, GT between target population and accessible population. And whatever the sample size, it has to be adequate and representative of the target population. Another important question where you may be given the steps, all, none, select a particular one, delete a particular one. So it's good to know all the steps. There are the steps in estimating the sample size. That you need to identify the major study variable, determine the type of estimate, indicate expected frequency of factor of interest, decide on desired precision of the estimate, decide on acceptable risks that estimate will fall outside its real population value, adjust for the population size, adjust for the estimated design effect, and adjust for the expected response rate. And again, I'm reiterating, a sample size has to be adequate and representative. Another important MCQ is regarding the different attention points in a project management or a study management, which you need to know. You may be given some of them and odd one out, which you have to point out, or there may be several odd ones and only one right one, which you have to point out. So these involve the human resource management, communication, time management, financial management, quality management, data management, teamwork and coordination, and of course, monitoring the progress and targets. Now, regarding the health research tools, how to design it, these steps are also very important. That you have to decide how to measure the concepts, relate the concepts to the study design and objectives, match the scale for measures chosen to analyze, ensure reliability and validity of the measure, choose most appropriate method of data collection, tailor the measures to the study participants, and decide how best to ask the actual questions. The different tools to collect data. There are abstraction forms for reviewing of the records, structured observation guides for checklist of items, and then there are questionnaire, which can be self-administered and can be interview administered. And the key elements of data collection tools, that it has to be clear, maintain a balance in the phrases, there should be, question should be short, comprehensive, there should be a constraint in the responses, it should be functional in being utilitarian in approach, the order of the question should be maintained, and the question should be contextual. So these are again MCQ areas. So what are the elements of data collection tools? And now coming to the basic 4 components of data collection tool. First is introduction and conclusion, identifiers, instructions for data collectors, and body of the instrument. These are the 4 basic components of data collection tool. Now coming to the data analysis. Well, the key objectives of data analysis are planning the analysis, program the crude analysis, deal with chance, biases and third factors, and assess the causality, and eventually measure the clinical or public health impact. So you have to choose between these while looking for the objectives of data analysis. Regarding the data management, it involves defining the variables and creating the study database and data dictionary, entering the data and correct errors, create data set for analysis, backup and archive the data set. The purpose of all these are the same for MCQ, choosing the odd one out or choosing the right one. Regarding the sequence of data analysis strategy, you have to firstly identify the study type, identify the main variables, become familiar with the data, characterize study population, examine the outcome on the exposure association, create the additional two-way tables, and conduct the advanced analysis. So these are important from the coming to the 2x2 contingency table. Understanding of these would go a long way in making you solve the small calculational MCQs which you might be having in your BCBR exam. So firstly understand this. Now coming to a bit of the ethical part, and another ethical aspect which for this content, and you find it's of benefit to you, do share with your friends, colleagues who might benefit from this as well. And thanks a ton for watching this and being a part of my virtual family. If you're new to this channel, don't forget to subscribe, put on a big thumbs up, and press the bell icon for more such academic contents.